Hey everybody, welcome back to the Outcomes Rocket. I'm here at AHIP 2024 in the amazing Las Vegas, Nevada, in the Wynn Hotel with the amazing Kye Gardner. Kye, welcome to the podcast.
Thank you so much for having me, Saul.
It's a pleasure to have you here. Quick intro on Kye. They are the Executive Director of Corporate Operations and Development, and I'm so excited to have you here, Kye, with us. Thanks for joining.
Thank you so much again for having me and that awesome intro here.
Yeah, absolutely. So Alera Health, we're gonna get into what you guys do. And ultimately, to begin with, tell us a little bit more about you and what got you into the work that you do.
Yeah, no problem. So grew up in southeastern Idaho, funny enough, and then I went to southeastern North Carolina, both wonderful, amazing places. And like much of the US and much of the world, they're not untouched by things like substance use or behavioral health issues and the landscape of the healthcare industry here in the US. And so through my experiences, personally, professionally in the behavioral health world, unfortunately I had an oldest brother who died of a fentanyl overdose.
Oh my gosh.
Heroin addiction, which was an absolute tragedy. And
I'm so sorry.
That fire, I appreciate you. The fire was fueled and I knew that some really close friends of mine and professional mentors, Mike Rhodes and Kathy Smith, had an organization previously known as Blaze Advisors, started in 2016 around population health management, integrating behavioral health into primary care, helping hospitals and health systems reduce the impact of behavioral health patients in their emergency departments, and for folks who are experiencing anxiety attacks or really bad depressive episodes, instead of going to the emergency department or possibly getting admitted to an inpatient psychiatric facility where mental health is kind of stigmatized and or catastrophized.
Yeah.
Hey, this person might just need some additional resources, whether that's community resources, rides to appointments, medication reconciliation. They could be in a domestic violence situation, and so they need to be safe in order to prioritize their own care and reconnect their mind, body, and spirit.
Right.
And so I got into this really, really awesome party and hot mess of the healthcare industry through being inspired by my own personal and professional experiences and wanting to make an impact and make sure that what happened to my loved ones or other folks' loved ones doesn't have to keep and continue happening for the future.
Thank you so much for sharing that very personal story, Kye. It's tough to see somebody go like that, and you know what? I'm sure your brother would be proud of the work that you're doing for others in the space, and we need this. There's a lack of understanding. There's not enough resources. Navigation is unclear. So the work that you and the Alera team are doing is critical. Let's talk about that. Tell us a little bit more about Alera Health and what the focus is and what you guys are doing.
Yeah, absolutely. So I want to do you and your audience, amazing audience, by the way.
Thank you.
Justice, and I've got
you guys
some
are
notes
awesome
here just to make sure that I can keep myself situated at 9 o'clock in the morning with a 3-hour time change. And so what we do at Alera Health is we are a population health management organization. And what that means is that we focus around behavioral health. The population of behavioral health, once you kind of see that whole group as an entity and see, hey, these folks have either co-occurring disorders, whether that's type 1 diabetes, chronic depression, maybe folks have an Alzheimer's or dementia diagnosis. You've got family who are possibly stretched thin. They're performing in a caretaking role. Maybe they've never done caretaking before. And so that's a lot of pressure, a lot of anxiety on those folks. And so what we at Alera Health do by focusing on the behavioral health population is that we work to prevent future issues because we know that when folks have undiagnosed behavioral health issues, that these things compound just over and over and over again, whether that's blood pressure, whether that's heart palpitations, frequent headaches, being afraid of going out in the world and socializing because they're so anxious or they're so depressed or they're so closed off. And so with Alera, what we do is we bring primary care providers, behavioral health providers, hospitals, health systems, community-based organizations, as well as other resources that support folks in finding more streamlined avenues of care, resources that they might need for health-related social needs, previously known as social determinants of health.
What was the term? Because we were talking about this yesterday. Yeah.
Health-related social needs. And yes,
health-related social needs.
And then there's a couple of other evolutions that are kind of out there, but it's really emphasizing the fact that sometimes your zip code is a better predictor of your health outcome than your genetic makeup, your ethnicity, whatever it might be. Depending on where you live, if it's a rural area, you're 30 miles from the nearest hospital, you have an anxiety attack, you're also maybe financially strapped, you're thinking about a $4,000 ambulance ride to take you to a hospital where those rural physicians may or may not be familiar with behavioral health, and they may admit you to an inpatient psychiatric facility because that's how they have functioned previously to manage through some of those mental health episodes. And so what we do with all of those organizations, we create clinically integrated networks around behavioral health. We also love to call them integrated systems of care, because it's a system of care that supports the patient, supports the providers, but also supports the payers through value-based contracting and value-based reimbursement to incentivize improving health outcomes and making sure that those folks get the help that they need.
That's fantastic. It's putting together the resources, the plan, the appropriate map of care. And then, I'm glad you brought up the payment side of things, because historically the payment model around mental health and behavioral health hasn't been well outlined or documented. Can you comment to some solutions that are coming up in that space, because it's a gap?
Oh yeah. And it's one of the pain points that the payers, providers, our communities are facing. And with the value-based reimbursement model, there's financial incentives for providers and communities, MCOs, ACOs, to meet certain metrics such as 7-day follow-up or 7-day readmission rate, doing breast cancer screenings, doing well-child visits. And while mom and kiddo or father kiddo, parent kiddo are at the clinic doing that well-child visit, hey, let's screen the parent for anxiety. Let's screen the parent for depression. Let's go ahead and just do a PHQ-9. And if mom might need some additional resources, let's see if we can connect her. The beautiful thing about One Care Networks is that clinically integrated network, again, branded as One Care Networks, not a sales pitch, but branded as our One Care Networks. They work with the whole patient and they work with the whole community within the One Care Network. So, for example, in Arizona, we're really excited that affiliated network providers, which is the name of one of our One Care Networks in Arizona, have gone from, and to rename a presentation that we've done, from competition to co-opetition. So instead of seeing these other providers and these other facilities as competition, hey, we want the referrals. No, we want the referrals. Hey, let's all get these referrals and make sure that these folks are getting the care that they need and that they're not coming back unless they absolutely have to or they need to. Getting these folks, a standard, fulfilling way of living that everyone deserves, and that everyone should have the right to.
Totally. I love that, Kye. And so I guess 2 follow-up questions. First one is the One Network. Mm-hmm. One of the issues that you mentioned is identification, right? Like people are not getting diagnosed. So is the idea that when you're in the network, as part of your primary care checkup, you get a mental wellness screen?
So that it happens a lot of ways. That is definitely one of them.
Okay.
One of the other ways is looking back at data. Whether it's data from those providers or looking at data from the network as a whole.
Fascinating.
Or looking at data that we already have, or data from large organizations such as Unite Us or SureScript, so prescription data, hospital data, and building models and or making informed decisions or analyzing data in a way that finds trends.
Sure.
And so there's, of course, AI is the hot topic.
Sure.
With certain algorithms and our technology that is augmented with our One Care Networks. we're able to analyze the data, pull information and draw conclusions and or sometimes assumptions from folks' historical data or their current data.
Wow, I love that.
The timeliness of it, the integrity of the data are all things that are absolutely integral to make those decisions. And then they also inform those value-based reimbursement agreements of, hey, we've been tracking this metric and we're now 5 points above, or if it's a timely metric, we've met this early every single time, or, hey, there's still these 2 other metrics that we need to meet in order to get that incentive bonus to, fuel the fire and the resources that are supporting those patients.
That's great. Thank you so much for highlighting that. So not only the in-clinic opportunities, but also taking a look at the data and making predictions and assumptions that could help bridge the gaps.
Absolutely.
Love that. Okay, and then so moving on to AHIP, because we're here and not everybody...
Oh, we're here.
We are here. Not everybody watching and listening to this had the chance to be here. So for the benefit of them, what's one insight that you've heard or come up with while you've been here that everybody watching and listening can benefit from?
I think one of the overarching themes is healthcare is difficult. Navigating healthcare is difficult. It's cumbersome. It's complex. It's riddled with wonderful things and some not so wonderful things that create barriers and or obstacles for folks getting the care that they need. One of the common threads that comes through that complexity is when you add behavioral health into the mix. Unfortunately, with stigma, unfortunately, with the way that mental health is viewed, some folks just kind of don't touch it. I'm really, really excited to say that through some of the sessions, the lunch and learns, the amazing keynotes, folks are weaving in behavioral health.
Nice.
It's starting to become a priority for folks because they're seeing these people come back again and again and again for sometimes the same issues or different issues, or they're taking multiple medications that have multiple different side effects. And when folks have certain diagnoses or are undiagnosed with things like bipolar disorder or schizophrenia or anything like that, when you don't have the resources or the necessary services to treat those folks and improve their lives and their outcomes, it creates a bigger bubble and it creates a bigger issue. And especially if that bubble gets bigger and bigger and it pops, there's going to be a lot of fallout, so to say, that will cost, unfortunately, at the end of the day, it's all going to take money.
Yeah.
It's going to cost those health systems more money, those people more money, the insurance organizations more money. And so what I'm really glad to report from AHIP 2024 in Vegas is that behavioral health is at the table. And that's really, really exciting thing.
I love that. Yeah, I definitely attended a couple sessions and also agree. It's top of mind and really exciting to hear that it's now part of the mainstream conversation.
Absolutely. And I do want to give just a slight plug for a wonderful organization that we partner with, Open Minds. Open Minds is a market intelligence organization that has a wonderful team of advisors who have worked decades in the industry, whether that's specifically in behavioral health or mergers and acquisitions or payer evolution, whether that's, used to be fee for service, now it's value-based reimbursement. And they help us help the providers learn about what a clinically integrated network is, how OneCare networks are different than your standard clinically integrated network. And as a partner for Open Minds, they also help us distribute resources, free resources for all folks to learn more about behavioral health integration, what value-based reimbursement means for their organization, and how those benefits can improve their communities.
That's fantastic. Do you have those resources handy? Is that something we could include in the show notes?
Absolutely.
Okay.
So yeah, I would be more than happy. We've got some great webinars. We've also got a couple of white papers. And of course, there's more information on our website, social media, but we'll give those plugs at another time.
Amazing. No, that sounds great. So folks, make sure you check out the show notes of this episode. I'm definitely going to be looking at that material. It sounds super interesting to really differentiate the types of networks and just get educated. If we're going to move the needle, we got to get educated.
Yeah.
So, okay, thank you for that, Kye. As we close out our session today, what call to action would you leave our viewers and listeners with? And what's the best place that they could get in touch with you and Alera Health?
Absolutely. So I want to say very pointedly and a little personally, be kind. You don't know what gentleness folks need because they may have had a very abrasive past. They might have had just an abrasive day and they just need a moment. So honestly, and just completely separate from any pitch, any podcast, wonderful, amazing thing, just be kind to each other, because that's going to help us overcome a lot of these struggles that we have. Once we all know that we might be struggling with something, or that behavioral health is something that affects so many of us, we're able to move the needle, we're able to make a difference, and we're able to embrace each other and those concerns. So main call to action, be kind. Other call to action, reach out to us. I'd say we're pretty good at being kind. We love to bestow that kindness upon others. And with our website, through our social media, through our videos, and we're evolving all the time. I mean, as a young company that just started in 2016, here we are about 8 years later, just growing exponentially, which is so amazing. And we're just developing resources all the time. Also, hold each other accountable, hold us accountable, hold yourself accountable to educating yourself around behavioral health, what you can do to connect your mind, body, spirit, your heart, your mind. The main call to action is get involved, educate yourself, find the folks that are doing the work, because they are out there.
I love that, Kye. Be kind, everyone. I think that's a great way to wrap this one up. Show kindness to yourself. Start there. And then to others. Great way to wrap this one up, Kye. And again, just a reminder, everything that we discussed today, the short notes, as well as the links that Kye and his team will share with us, are going to be in the show notes. So check those out. Take action. If something that Kye said today resonated with you, take action on it, whether it's reaching out to them or reading the materials that they're going to share with us. Kye, thanks so much for being with us today.
Absolutely. Would you like a trademarked Kye 5?
I do want one. Hold on, let's try it again. I love it. Epic. Great to see you, Kye. And everybody, thanks for joining us. Stay tuned for more insights from AHIP 2024. See you all later.